Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is a question series all about miscellaneous infections, including TB, ticks, and typhus.
Okay, let's do some questions. Question 1. Which regimen is commonly used in the initial phase of treatment for drug-susceptible TB? A. Isoniazid, rifampicin, ethambutol, and pyrazinamide. B. Isoniazid, rifampicin, ciprofloxacin, and pyrazinamide. C. Rifampicin, ethambutol, ciprofloxacin, and isoniazid. D. Isoniazid, rifampicin, levofloxacin, and pyrazinamide. E. Rifampicin, ethambutol, linezolid, and pyrazinamide. If you recall, the standard treatment for the initial phase of a drug-susceptible TB is going to be option A, which is isoniazid, rifampicin, ethambutol, and pyrazinamide. A good mnemonic to remember that is RIPE. R for rifampicin, I for isoniazid, P for pyrazinamide, and E for ethambutol. Question 2. A 50-year-old male presents with a months-long history of night sweats, weight loss, fever, and a non-productive cough. Physical examination reveals enlarged cervical lymph nodes. What is the most likely extrapulmonary manifestation of TB in this case? Options are A. Pott's disease, B. Gastrointestinal TB, C. Lymphadenitis or scrofula, D. Renal TB, E. Miliary TB. The correct option is going to be option C, which is lymphadenitis or scrofula. So this is quite a straightforward case because they have given you a very classic presentation of pulmonary TB in a 50-year-old patient with night sweats, weight loss, fever, and a non-productive cough. However, they've also told you that on physical examination, you have picked up enlarged cervical lymph nodes. And if you recall, the cervical lymph nodes that are enlarged associated with TB is known as lymphadenitis or scrofula. Therefore, option C is the correct option. Let's do some questions. Question 1 is a 34-year-old woman presents with a diffuse maculopapular rash, including on her palms and soles, along with generalized lymphadenopathy and flu-like symptoms. Which stage of syphilis is most likely based on her presentation? So this is giving you a diagnosis already that this is syphilis, but they're asking you to categorize what stage she's exactly at. A. Primary syphilis, B. Secondary syphilis, C. Latent syphilis, D. Tertiary syphilis, E. Congenital syphilis. And with just a quick look, you will realize that option A is completely incorrect because she's 34, so she's not going to have congenital syphilis. Option A, if you remember, is when you have your painless chancre, so that's not going to be right. And option C is the latent syphilis, which is, if you recall, is happening within the first year, depending if you're talking about early latent or late latent, but you're talking about nearly, a few months to more than a year, possibly. So that's not going to be correct. And then option D, which is a tertiary syphilis, is also not going to be correct because recall that tertiary syphilis, you do expect many years to decades to pass from the initial infection. And more importantly, classically, the way that they are describing the scenario to you with the presentation of the diffuse maculopapular rash affecting the palms and the soles and generalized lymphadenopathy is really quite classic for secondary syphilis. which you have the mucosal involvement and you have that non-specific constitutional symptoms such as fever, malaise, and lymphadenopathy. Therefore, the correct option is going to be option B for secondary syphilis.
Okay, so now let's try a question. So a 20-year-old gentleman presents with a left-sided facial droop of 3 days duration. He reports feeling fatigued since returning from his summer holidays to Delaware. On examination, he is found to have a rash resembling a bullseye on his lower limbs. The lumbar puncture is positive for Borrelia PCR. What is the name of the rash? So your options are erythema marginatum, erythema migrans, erythema nodosum, erythema artefactum, and erythema albigni. So you'll remember from our previous slides that the correct answer is erythema migrans, which is also described as a bullseye or a target lesion. If you'd like to know more about any of these rashes, particularly erythema nodosum, we do have some dedicated videos for these, which can be found in our dermatology playlist. I'll just link that up here for you. Let's try a question. A 25-year-old zookeeper presents with high fever, severe muscle pain, conjunctival suffusion, and headache. Leptospirosis is suspected. Which diagnostic test is most appropriate to confirm leptospirosis in this patient? So our options are blood culture, the RPR test, microscopic agglutination test, HIV antibody test, or urinalysis. So we know from the video that our two options really for leptospirosis, or the two main options, are the microscopic agglutination test or ELISA. So in this case, option C is correct. So let's now try a question. So a 23-year-old man who has sex with men, MSM, presents with a 1-week history of acute right knee swelling and pain associated with limitations in movement. There is also complaint of pain on urination, as well as bilateral painful red eyes. A diagnosis of reactive arthritis is suspected. What is the most likely result of the joint aspirate? So our options are negatively birefringent needle-shaped crystals, calcium pyrophosphate crystals, neutrophil count of more than 150,000, positive for C. trachomatis, blood-stained aspirate, or a neutrophil count of 25,000 with cloudy aspirate and a negative culture. So if we take each of these answers in turn, A is incorrect. So this describes negatively birefringent needle-shaped crystals. If you recall from our rheumatology videos, this is a classic description of what is seen when synovial fluid from a patient with gout is analysed. If you'd like to know more about gout, you can click on the link at the top of the screen right now to take you to our video. Answer B is calcium pyrophosphate crystals. This is a classic finding in people with pseudogout or calcium pyrophosphate disease. If you'd like to know more about this, click on the link at the top of the screen, which will take you to our rheumatology video on CPPD. C tells us that the person has a neutrophil count of more than 150,000 and is positive for C. trachomatis. Now, we are told that the timeline and the suspicion from the clinical picture is of reactive arthritis. What is described here in answer C is consistent with a septic arthritis, so a more acute picture, and this is with a classically very high neutrophil count and also a positive culture. So this is actually incorrect. This is not what you would see in a true reactive arthritis. However, if you'd like to know more about septic arthritis, you can click on the link at the top of your screen now to remind yourself about what is seen in a case of septic arthritis. And option D is a blood-stained aspirate. Well, you may see a blood-stained aspirate, it's unlikely, but it's certainly not specific or diagnostic for Chlamydia trachomatis reactive arthritis. And finally, option E, neutrophil count of 25,000 with cloudy aspirate and negative culture. So this is the correct answer because we've got a slightly high neutrophil count that's not too high, a negative culture, and yet we also have a bit of a cloudy aspirate as well. So it's not a normal aspirate. So this is the correct answer. If you'd like to remind yourself about reactive arthritis more broadly, you can click on the link at the top of your screen to take yourself to the relevant video in our rheumatology series.
So let's do a question. A 40-year-old man presents with a high fever, severe headache, and a maculopapular rash that started on his wrists and ankles and has spread to his trunk. He reports recent hiking trips to the Rocky Mountains. Which of the following is the most likely diagnosis? Option A is epidemic typhus. Option B is endemic typhus. Option C is a scrub typhus. Option D is Rocky Mountain spotted fever. And option E is Lyme disease. So this was a really straightforward question because the biggest giveaway is that he's traveled to the Rocky Mountain regions and he's coming in with quite classic features with high fevers, headaches, as well as a maculopapular rash. So really the correct option is going to be option D, which is the Rocky Mountain spotted fever.
Right, so let's try a question. A 45-year-old farmer presents with a 2-week history of high fever, severe headache, myalgia, and a dry cough. He reports recent exposure to cattle and sheep during birthing season. Laboratory tests reveal elevated liver enzymes and mild thrombocytopenia. Which of the following is the most appropriate initial treatment? So our options are amoxicillin, ciprofloxacin, doxycycline, azithromycin, or metronidazole. So you will recall from this video that the correct answer is doxycycline for the treatment of Coxiella burnetii, which this certainly seems to be in this vignette, given all of the symptoms and the time frame of 2 weeks.
Okay, let's do some questions. A 65-year-old gentleman presents to A&E with acute worsening shortness of breath with a cough productive of green sputum. He came off a flight from Lanzarote 48 hours ago, where he had been staying in an air-conditioned rented apartment alone. On examination, he has a temperature of 38.5 degrees and reduced air entry on the right side of his chest. He's requiring 4 liters of oxygen via nasal cannulae to maintain his saturation at 96%. Given the likely diagnosis, what is the causative agent? So the options that you've got are A, Haemophilus influenzae, B, influenza, C, Streptococcus pneumonia, D, Legionella, and E, Staph aureus. And going back to the clinical vignette, it is a really classic case of somebody who is a middle-aged man who's presenting after coming back from holiday and staying in an air-conditioned place, and is presenting with a diagnosis of pneumonia. Hopefully all of you had clicked that this is a case of pneumonia, and given sort of the phenotype of the disease in the clinical vignette that's been described for you, you would realize that this is a case of Legionella disease.
So now let's try a question. An 80-year-old lady who has been in hospital following a hip fracture is found to have a temperature of 39 degrees, respiratory rate of 30, and oxygen saturations of 90% on room air at a medical emergency call. She is 5 days post-op. A portable chest X-ray shows right-sided consolidative changes. Given the likely diagnosis, which of the following statements is incorrect? So our options are Staphylococcus aureus is a common causative organism. Intravenous antibiotics are indicated. Third-generation cephalosporins will usually provide sufficient antibiotic cover. Strep pneumonia is an uncommon cause. And CURB-65 scoring can be used for severity assessment. So the correct answer in this case is E, because CURB-65 scoring should be used for community-acquired pneumonias and not a hospital-acquired pneumonia, which is diagnosed based on signs and symptoms, as well as the fact that the patient has been in a care setting for over 48 hours. So now let's do a question. A 75-year-old man with a known history of motor neurone disease presents to the medical take with a 2-day history of confusion and pyrexia. The IMT1 doctor takes a collateral history from the patient's wife, who reports the patient has had choking episodes and swallowing difficulties over the past couple of days. On examination, he has a temperature of 39.5 degrees and right-sided inspiratory crackles. His chest X-ray is normal. Given the likely diagnosis, which of the following is incorrect? So our options are initiation of intravenous antibiotics is indicated, a medication reconciliation is indicated, aspiration pneumonia is unlikely given the normal chest X-ray, Metronidazole would be the antibiotic of choice. A salt assessment is indicated. So the correct answer here is C, because the chest x-ray may be normal in the early stages of an aspiration pneumonia, which is the top differential diagnosis here.
Let's do a question now. A 65-year-old man is admitted to ED with a suspected bacterial infection. He is febrile with a temperature of 38.5 and his blood pressure is 90/60. His respiratory rate is 22 per minute and his heart rate is 110. Laboratory test shows a white blood cell count of 15. An arterial blood gas analysis reveals a PCO2 of 30. Based on the systemic inflammatory response syndrome or SIRS criteria and his clinical presentation, which of the following is the most appropriate next step in the management of this patient? The options include A. Administer high flow oxygen and reassess in 24 hours. B. Initiate broad spectrum antibiotic and begin fluid resuscitation. C. Discharge with oral antibiotic and schedule a follow-up in 48 hours. D. Perform a chest x-ray and start antipyretics only. E. Wait for further laboratory results before initiating any treatment. And as you can see, a lot of these options in real life happen all together. That is to say, for instance, giving high flow oxygen or performing a chest x-ray and giving antipyretics. However, the wording of the question is clearly describing someone who is acutely unwell and needs resuscitating there and then. Therefore, the correct option is going to be option B, which is initiating broad spectrum antibiotic and starting fluid resuscitation. A lot of the other things, as I said, such as giving high flow oxygen and also getting a chest x-ray, are accurate. However, rest of the answers, which are reassessing in 24 hours or the only at the end of option D, make them an incorrect option. Option C and E are completely incorrect, as discharging a patient who is hemodynamically challenged is not going to be appropriate, and waiting longer for further tests to become available is also not appropriate.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.